The gallbladder is a little sac-like organ. It's a little pouch that sits underneath the liver. It has bile inside of it. Its main function is to squeeze and release the bile to help digest foods, primarily fatty foods. So after you've eaten something greasy or fatty, then the intestine will send a signal to the gallbladder to squeeze and send bile into the intestine to help digest the fats. Stones form in the gallbladder, what we call gallstones, because of an imbalance in some of the body's chemicals. And those chemicals, without getting too deeply into it, include cholesterol and some of the bile material. And when there's an imbalance in those chemicals, then stones will tend to develop. There is nothing that you can do about these chemicals. This is usually mainly a genetic issue. It's more common in women. It's more common in the Hispanic population and American Indian population. In terms of the symptoms that you develop with gallstones, it's primarily a heavy pressure, either here in the stomach or right underneath the right chest. Oftentimes goes to the back. Usually lasts for about a half an hour. It can last for much longer than that, and that's usually what sends patients to the emergency room. This usually happens after eating something greasy or fatty, usually about a half an hour or so after doing that. Some patients will tell us that they have problems with bloating or sometimes diarrhea. Most of the time we see patients, the problems are fairly mild or relatively mild, and they've been going on for years. Every once in a while some patients will get severe attacks, and we'll see them after they've been to the emergency room several times. Many people will develop gallstones, but really the only time you need to worry about them is if they start to cause you problems. I say that because only 15% of patients that have gallstones will actually need anything done about it. And those are the patients that are having symptoms. If you have a test for, say, an ultrasound for pregnancy or for some other reason, and they happen to find gallstones by accident, then we do not need to do anything about those gallstones. It's only when they start causing you problems that we need to do anything about them. As I said, most patients that have gallstones, as long as they don't have symptoms, then we really don't need to do anything about it. You do not need to have an operation. However, what we know is once you start having symptoms, then you will continue to have symptoms. So if you've been having problems that I mentioned, pain after eating, then you should definitely have this taken care of. Because if you don't, then it might need to be taken care of as an emergency situation. And having to operate as an emergency situation might involve a much more bigger operation. Also, not doing anything about the gallstones can result in other complications such as inflammation of the pancreas, or the stone slipping out into the main duct and causing jaundice or yellowness of the eyes, and which causes more severe pain, and which requires, again, additional procedures to take care of the stones. So it's best to take care of the gallstones once you start having problems. Don't wait because there are possible complications that occur if you don't get them taken care of. We have some patients that we see that have been having problems for years because their doctor or somebody else told them that they didn't need to do anything because their stones were small. That actually is not true. The smaller the stones, actually the worse the problem is, because it's the small stones that can get out into the main duct and cause further problems. So usually the size of the stone, the number of the stones really doesn't mean anything. one stone can cause problems, a small stone can cause problems, a large stone can cause problems. So again, if you have an ultrasound that showed you have gallstones and you are having problems, then something needs to be done. As I mentioned, once you've been diagnosed with gallstones and they are causing you problems, then it's important that you have them taken care of. And really the only way to treat them is with surgery. There are many myths that you'll read on the internet, such as the gallbladder flush, where you drink something and it causes the gallstones to flush out. Gallstones are not like kidney stones. Gallstones, you do not want them flushing out of the gallbladder, because if they do come out of the gallbladder, they're going to go into the main duct. And once they go into the main duct, it becomes a much bigger problem. So I don't think the gallbladder flush works in the first place, but if it does, you do not want those stones going into the main duct. There are no medicines that dissolve the stones. There are some medicines that we've tried long ago, but they really didn't work. They just made the patients sick. There's no way to blast them or break them up with ultrasound like we used to do with kidney stones. So really the only way to treat them is with surgery. As I mentioned, as far as treatment goes, surgery is really the only way to take care of this problem. As far as the operation, it's 4 little holes, about a half an hour to an hour operation. Same day surgery, go and have it done and go home the same day. As I mentioned, patients will ask us if there's any medications that they can take to get rid of the stones. And the answer, truly, the answer to that is no. There are medications that we've tried in the past to dissolve the stones, but they cause nausea and bloating and diarrhea, and hardly ever really dissolve the stones. And again, as I mentioned before, we've tried breaking them up with ultrasound. That didn't work. So really the only option is surgery.